identified him as positive. We are now tracking him from Lagos back to Ogun State.
February the 27th, 2020. That was the day the first case of COVID-19 was reported in Nigeria, and the landing point was the nation's commercial center, Lagos, almost crippling economic activities in the state following the lockdown declared to curb its spread. Managing the first wave of the deadly virus was a big task for the state government. Several isolation centers sprang up across the state to help in the care of people who had contracted the virus.
At the time I caught it, it was almost like a death sentence. So one had to, in so many ways, try to muster the courage to be able to try to defeat the disease, and that was largely emotional.
Frontline health workers had their hands full taking care of patients, and this did not escape the state government.
I feel it's a privilege for me. I wasn't expecting this. All the same, I appreciate what the government has done, what Lagos State has done.
10 months down the line came the festive period, and residents threw caution to the wind, and the number of infections spiked, ushering in the second wave in mid-January with such intensity that required the use of large amount of oxygen for critical patients.
We were able to flatten the first wave very quickly and bring it under control. So at no point in time did the number of cases presented in Lagos exceed our capacity to manage them. The nature of the COVID-19 infection in the second wave was a bit different from the first wave. It was obviously more aggressive, affected younger people, and it caused more people to develop lung complications and the need for oxygen. If the virus changes, if it continues to mutate and become more aggressive, then we may see a third wave in Nigeria.
In the next few weeks, Lagos State will be rolling out COVID-19 vaccine, according to Professor Bayomi, who says the health workers are overwhelmed with the crisis and hopes to turn a new page.
The decline in figures suggests that both our medical and our non-medical interventions are working. Our medical fraternity are exhausted. We have to refresh them. We want other kinds of issues to deal with. In the next few weeks, we will be rolling out the vaccines in Lagos. The deployments will be coming from Abuja. And then we will see, based on how much they send us, whether Lagos State has to procure its own vaccines.
So far, the state has recorded over 50,000 cases with over 47,000 recoveries across communities and 300 deaths. The state government says the battle continues and is asking all residents to adhere to safety protocols.